Dr. Chatterley, I would like you to tell us a little bit about the philosophy of your practice. You know, what type of cases do you treat? What's going on? And also maybe how you became a dentist.
Well, I became a dentist really just observing in high school. As you know, when you enter high school, it's like fun and games, and then you start getting towards junior and senior year, and you know you're going to have to go out and go to college, decide what you're going to do in life, head in a direction. They had an effective career day, and I signed up to go hear this dentist, and I knew a couple dentists that went to church with us, and I thought, you know, they seem to have a pretty good family life and career. Let me see what this is about. And I decided I liked he made a great presentation, made a good impression on me, and I decided, okay, I'm going to set my sights to become a dentist. And so I went to college and took pre-dent, and then got into dental school, went through dental school. My best friend right next to me that I sat next to all through dental school, wanted me to continue, and he was going to go on to be an orthodontist. I just wanted to go out and treat people and do general dentistry. And the philosophy in our practice is, years ago they called that it was common to call practice family practice. Well, the profession has kind of gotten away from calling practice a family practice, but that's basically what we have is a practice that we treat the children, we treat adults, we treat elderly, and we try to do as many of the procedures so that they don't have to be referred out. As you establish yourself in a community and become a service to that community and to the patients that they refer and the family, they want to be able to go to one office to where they're used to going and receive service and not, unless it's a very entailed special case, not have to go for other treatment elsewhere.
Wow.
So we try to provide, every morning we have our little meeting, and our summarized mission statement is comfortable care with genuine concern. So we have a longer mission statement, but that's the short version: to provide comfortable care with general concern, to teach prevention, and also when we introduce a new patient, we ask them. We establish right off the bat that they're in charge. We say our job as the dentist and the dental team in the office, our job is to make you aware of what dentistry can do for you. Your job is to decide how much to do and how fast to do it. So they don't, years ago there's an article that came out in Reader's Digest that was a black eye to dentistry because they did kind of this survey by going to different dental offices, getting different opinions on what they needed. And as this group of people did this research, they came away feeling like they were having these various treatment plans that varied widely. They were having unnecessary dentistry basically shoved down their throats, so to speak. They were being sold a bill of goods, and they came away with a distrust. Well, there's two answers to that. There's dentistry is not all science; it's an art and a science. So if somebody is better trained in cosmetics, and when they look in somebody's mouth and they can see, well, cosmetically I can provide you with all these things. But that's why we say to the patient, we'll let you know what dentistry can provide for you. Then it's your job to decide how much you want and how fast you want to proceed.
All right.
And that de-stresses, and then everybody's happy.
Right. Well, it's kind of like it's probably a bad example, but a Honda and a Mercedes. Not everybody wants a Mercedes, even if they have the money to buy one. You know what I mean?
It's not exactly a bad example. I use that example all the time. People relate to cars and automobiles. They say, all I want is a car that's functional. I want to be able to drive from one place to another. Well, maybe they want dentistry that's functional. And then another person says, I want the most elite, best-looking, appearing possible cosmetic smile that you can produce.
Right.
They want the Mercedes.
Right. Now, I have friends who have tremendous amounts of more money and drive a not as good car as I drive. And, it's nothing to do with money. I mean, sometimes it does. Sometimes we want something really good and can't afford it. That's one story. At that point, probably people start working towards it. If they want to have that Tom Cruise smile, but it's right now not in the pocket, well, at least there's a plan now which can be put aside. You know what I mean? To get it. Okay? But wonderful. Absolutely great. So basically, your main intention is for people to make sure, like we talked about, that, if their jaws are not aligned, if certain things happen, they can have headaches, they can have all kinds of stuff. People who snore, they might not be able to sleep well, and basically make sure that dentistry, or for instance, if they have too many missing teeth, they may be getting a caved-in feeling, look like a dried-out tomato, which then that is not what they want, because that would be now not only just a Honda, that would be a damaged Honda, and that they don't necessarily want. They do want to have a good Honda, So,
right.
So basically, that's kind of like first, and I'm sure, you let them know that, and from there, people can build and say, so what about if we change, this or that a little bit, and then obviously you can do that too. I know you do orthodontic work, you see children. You must have in your practice moms who have been with you when they were children.
Yes, we have multi-generations. Definitely, they started out as children, and now they're young married and have children. They're bringing them their parents, and we have, in some cases, there's 4 generations that are being treated.
Wonderful. Well, wish you all the best. Thanks for letting us know all about dentistry. You've done a wonderful job. Thank you very much.
Thank you.